Okay, so get this.
Mm-hmm.
You know how sometimes you hear like a crazy medical story
Yeah,
and you're just like, no way, that can't be real.
right.
Well, today's deep dive is all about one of those, wait, what?
Mm.
Situations.
Okay.
Exogenous hyperthyroidism.
Interesting.
Basically, it's when you have an overactive thyroid.
Mm-hmm.
But the thing is, the culprit is something you've ingested.
Hmm.
And the kicker is, it can happen even if you're not trying to mess with your thyroid at all.
Wow.
We've got this fascinating medical text here
Okay.
that dives deep into this. I can't wait to unpack it with you.
What's intriguing about exogenous hyperthyroidism is that it often flies under the radar.
Oh, really?
People might experience symptoms and never connect the dots back to something they ate or a supplement they took.
That's wild.
Yeah.
So let's break this down.
Yeah.
What exactly is causing this thyroid hormone overload in the first place?
Well, the most common cause is actually a medication called levothyroxine. It's synthetic thyroid hormone, often prescribed for an underactive thyroid.
Right.
But if you take too much, either accidentally or intentionally, it can tip the scales in the opposite direction, leading to hyperthyroidism.
So it's like taking medicine to fix a problem,
Right.
but then ending up with a different problem because of the medicine itself.
Exactly.
Ironic, to say the least.
Exactly. But here's where it gets even more interesting.
Okay.
Remember that, no way, that can't be real feeling I mentioned.
Yeah.
Well, strap in.
Okay.
Because you can actually get exogenous hyperthyroidism from contaminated meat.
What?
It's called hamburger thyroiditis.
Hamburger thyroiditis.
It's exactly what it sounds like. Thyroid tissue from cows accidentally ending up in ground beef.
Hold on. So
Yeah.
you're telling me I could unknowingly eat a burger?
You could?
That's messing with my thyroid.
Uh-huh.
That's both fascinating
Yeah.
and slightly terrifying.
It is.
Has this actually happened before?
Oh, it's not just a theoretical risk.
Okay.
There have been real outbreaks of hamburger thyroiditis.
Wow.
Sometimes affecting dozens of people.
Really?
Back in the 1980s, there was a notable outbreak in the Midwest. And it led to stricter regulations on meat processing.
That makes sense.
Imagine thinking you're just enjoying a barbecue,
Yeah.
and suddenly you're dealing with the effects of too much thyroid hormone.
That's a plot twist I wouldn't want in my life.
Right.
But
Yeah.
this brings up an important point for our listeners.
Sure.
Knowing about hamburger thyroiditis could actually change the way you choose your meat.
Yeah.
Maybe opting for whole cuts instead of ground beef, or being extra careful about the source of your meat
Right.
could help avoid this unexpected thyroid adventure.
Absolutely.
Okay, good to know.
It's all about being an informed consumer.
Right.
And while the thought of thyroid burgers might make you want to swear off meat altogether,
Yeah.
it's important to remember that this is relatively rare, especially with modern food safety standards.
Okay, good to know.
Yeah.
But it's not just accidental ingestion, right?
Yeah.
Our medical text also mentions people intentionally taking excessive thyroid hormone.
That's right.
Okay.
Sometimes it's for legitimate medical reasons,
Okay.
like treating thyroid cancer or shrinking goiters.
Right.
But unfortunately, there's also misuse, often driven by the misconception that thyroid hormone is a magic bullet
Oh.
for things like weight loss, menstrual issues,
Wow.
depression, or even infertility.
Wow. So people are self-prescribing thyroid hormone for all sorts of things.
They are.
That sounds incredibly risky.
It is risky.
Okay.
Thyroid hormone is a powerful substance.
Yeah.
And like any medication,
Right.
it needs to be used carefully and under the guidance of a healthcare professional.
Of course.
The potential side effects of taking too much can far outweigh any perceived benefits.
So we've got accidental ingestion through contaminated meat,
Right.
intentional overuse, and of course, the potential for taking too much medication.
Yeah.
Let's talk about what actually happens when you have this excess thyroid hormone
Okay.
coursing through your system.
Sure.
What are the symptoms of exogenous hyperthyroidism?
Well, many of the symptoms mimic what you'd see with any type of hyperthyroidism.
Okay.
Think rapid weight loss. Even if you haven't changed your diet or exercise habits,
Okay.
feeling constantly hot and sweaty, tremors, a racing heart, and perhaps anxiety, increased bowel movements, and shortness of breath.
Wow.
It's like your body's metabolism is stuck in overdrive.
Not exactly a walk in the park.
Right.
And I'm guessing these symptoms can range from mild to severe,
Yes.
depending on how much excess hormone is involved.
You're right.
Okay.
It's a spectrum.
Got it.
Some people might experience just subtle changes,
Yeah.
while others have more pronounced symptoms.
Yeah.
So it can vary quite a bit
Yeah.
from person to person.
Makes sense.
And even from case to case.
Right.
Depending on, all those different factors we talked about, like
Right.
the source of the excess hormone,
Right.
the amount, and how long it's been going on.
Okay.
So it's not a one-size-fits-all kind of thing.
Right. It's a bit more complex than that.
Exactly.
Okay. So we've got this picture of a body in overdrive
Yeah.
dealing with a thyroid hormone overload.
Mm-hmm.
But you mentioned earlier that there are some key differences
Right.
between exogenous hyperthyroidism
Uh-huh.
and other types of hyperthyroidism, like Graves' disease.
Yes,
Can
absolutely.
you walk us through those?
Absolutely.
Okay. Okay, so we've got this picture of a body in overdrive
Right.
dealing with a thyroid hormone overload.
Mm-hmm.
But you mentioned earlier that there are some key differences
Right.
between exogenous hyperthyroidism
Uh-huh.
and other types of hyperthyroidism,
Yeah.
like Graves' disease.
Yes,
Can you
absolutely.
walk us through those?
Absolutely. One of the telltale signs of Graves' disease is exophthalmos, which is the bulging of the eyes.
Right.
But that's specifically related to the autoimmune process in Graves,
Okay.
not simply the presence of excess thyroid hormone. So you wouldn't expect to see that in someone with exogenous hyperthyroidism.
That's a good distinction to keep in mind.
Yeah.
So no bug eyes.
Right.
Even if your heart is racing like crazy.
Yeah.
What's the other key difference?
And usually there's no goiter,
Okay.
which is an enlarged thyroid gland.
Right.
Now, this might seem counterintuitive because you'd think more thyroid hormone would equal a bigger thyroid, right?
Right.
But it's actually the opposite.
Oh, okay.
The excess hormone coming from outside the body
Mm-hmm.
actually suppresses the thyroid,
Interesting.
telling it to slow down production.
Ah, so it's like the thyroid is saying,
Yeah.
hey, we've got plenty of hormone here. No need for me to work so hard.
Precisely. Of course, there can be exceptions.
Right.
If someone already had a goiter and was taking thyroid hormone to try to shrink it,
Right.
the goiter might persist,
Okay.
even if they develop exogenous hyperthyroidism.
Makes sense.
It's always about looking at the whole picture.
And speaking of the whole picture, we touched on this earlier,
Uh-huh.
but a sudden massive overdose of thyroid hormone can be really dangerous, right?
Absolutely. The medical text highlights this,
Okay.
especially for older individuals who might already have underlying heart conditions.
Right.
A large overdose can put tremendous stress on the heart
Mhm.
and even lead to a heart attack.
Wow.
It's a stark reminder that even though thyroid hormone is a common medication,
Right.
it's not something to be taken lightly.
It's like the difference between adding a pinch of salt to your soup
Yeah,
and accidentally dumping the whole shaker in.
exactly.
A little bit can be beneficial,
Right.
but too much can be disastrous.
It can.
So it's not just about those dramatic acute overdoses.
Right.
What about long-term effects?
That's an important point. Chronic low-grade overdoses,
Mm-hmm.
even if they don't cause immediate alarming symptoms,
Right.
can still take a toll over time.
Really?
The skeletal system can be affected,
Mhm.
increasing the risk of osteoporosis and fractures.
Oh, wow.
And the cardiovascular system is particularly vulnerable,
Okay.
with potential consequences for heart health in the long run.
So it's a bit of a ticking time bomb situation.
In a way, yes.
You might not feel the effects right away,
Right.
but they could be building up beneath the surface.
Exactly.
Now let's shift gears and talk about how doctors actually diagnose exogenous hyperthyroidism.
Okay.
What are the clues they're looking for?
Lab tests are the cornerstone of diagnosis.
Okay.
The first clue is a low TSH level.
Okay.
Now, TSH stands for thyroid-stimulating hormone,
Right.
and it's basically the signal from your brain to your thyroid,
Okay.
telling it how much hormone to produce.
Got it.
But when you're getting an excess of thyroid hormone from an external source, your brain says, hold up, thyroid. We're good on hormones here.
Right.
Take a break.
Okay.
So TSH levels drop.
Okay, that makes sense.
Yeah.
Low TSH check.
Right.
But what about measuring the thyroid hormones themselves?
Okay.
T4 and T3.
Those levels can be a bit trickier to interpret.
Oh, really?
They might be elevated,
Okay.
but they could also be normal,
Huh.
depending on the type and amount of thyroid hormone ingested.
Okay.
So while T4 and T3 measurements are part of the puzzle,
Mm-hmm.
they don't always give you the definitive answer.
So we need more pieces to this diagnostic puzzle.
We do.
What else are doctors looking at?
Two other tests are really helpful
Okay.
in confirming exogenous hyperthyroidism.
Okay.
One is the radioiodine uptake test,
Okay.
which measures how much iodine your thyroid is absorbing. Remember, your thyroid needs iodine to make thyroid hormone.
Right.
But in exogenous hyperthyroidism,
Yeah.
the thyroid's activity is suppressed.
Okay.
Because its uptake of iodine will be very low.
It's like the thyroid's on vacation.
Yeah.
Sipping a tropical drink.
Right.
And saying, iodine, nah, I'm good for now.
Exactly. And the other important test is the thyroglobulin level.
Okay.
Thyroglobulin is a protein produced by the thyroid, and when its levels are low,
Okay.
it points away from other causes of hyperthyroidism and
like
towards the exogenous kind.
Got it.
So it's like a detective case, and
Yeah.
all these clues have to line up.
Right.
Low TSH,
Mm-hmm.
specific patterns of T4 and T3,
Okay.
low radioiodine uptake,
Right.
low thyroglobulin,
Uh-huh.
to point to exogenous hyperthyroidism.
Wow.
Once the diagnosis is made,
Yeah.
that's where we dive into the world of treatment options.
Okay.
And luckily,
Yeah.
there's a range of approaches depending on the severity of the case.
Okay, let's talk treatment.
Okay.
What can be done to get those thyroid hormone levels back in check?
In most cases, the first step is pretty straightforward.
Okay.
Stop or reduce the dose of the thyroid hormone that's causing the problem.
Makes sense.
This might involve adjusting the dose of levothyroxine, or if the issue is contaminated meat or a supplement, simply eliminating that source.
Right, but I'm guessing it's not always that simple.
Right.
Especially if someone's symptoms are severe.
Yeah.
Do they just have to wait it out until the hormone levels go down?
Not necessarily. There are a few tools in the medical toolbox
Okay.
to help manage those more intense cases.
Okay.
One option is beta blockers,
Okay.
which are medications often used to treat high blood pressure
Right.
and other heart conditions.
Mm-hmm.
They can also help alleviate some of the uncomfortable symptoms of hyperthyroidism,
Okay.
like a racing heart and anxiety.
Beta blockers.
Yeah,
The multitaskers of the medication world.
exactly. They're like a quick fix
Oh.
to help people feel better while their body works on getting those hormone levels back to normal.
Got it.
Now, if the excess thyroid hormone is primarily T4,
Okay.
which is the type your thyroid naturally produces, doctors might use medications that block the conversion of T4 to T3.
Okay.
T3 is the more potent form of thyroid hormone.
Right.
So blocking that conversion can help bring things back into balance more quickly.
So it's not just about lowering the overall hormone levels.
Right.
But also about tweaking the balance between T4 and T3.
Precisely.
Clever.
And there's another interesting treatment option called cholestyramine.
Okay.
It's a medication that binds to thyroid hormones in the gut, preventing them from being reabsorbed into the bloodstream.
Oh, so it's like intercepting those hormones
Yeah,
before they can cause more trouble.
exactly.
Kind of like a security detail for the thyroid.
That's a great way to think about it. It's all about giving the body a helping hand
Okay.
in clearing out that excess hormone.
Got it.
Now, for those extreme cases,
Yeah.
like those massive overdoses we talked about earlier,
Right.
more drastic measures might be needed.
Okay.
Plasmapheresis is one such intervention.
Plasmapheresis.
It's a procedure that essentially filters the blood,
Wow.
removing excess thyroid hormone directly.
Wow, that's getting into some serious medical territory.
It is.
But it's reassuring to know that there are options for those really critical situations.
Absolutely. It's all about having a range of tools
Right.
to address the full spectrum of exogenous hyperthyroidism cases.
So we've covered a lot of ground here.
We have?
From the causes and symptoms to the diagnosis and various treatment options. It seems like there's a lot to consider when it comes to this condition.
There is.
But before we wrap things up,
Here.
I'm curious about the recovery timeline.
Okay.
If someone stops taking excess thyroid hormone
Yeah.
or eliminates the source of contamination,
Mm-hmm.
how long does it take for their body to get back to normal?
That's a great question according to our medical text.
Okay.
When people stop taking thyroxine,
Mm-hmm.
their T4 levels drop by about half every 7 days.
Okay, so a week
Yeah, about a week.
to get those T4 levels down by half.
Right.
Okay, what about T3?
T3, on the other hand,
Uh-huh.
clears out of the system much faster
Okay.
with a half-life of about a day.
Okay, so it's not instantaneous,
Yeah.
but it's not a super long haul either,
Right.
especially for T3.
Right.
I guess it makes sense since our bodies are constantly making and breaking down thyroid hormone anyway.
Right. It's a dynamic system.
Yeah.
Always adjusting to maintain that delicate balance.
Right.
But when something throws it off, like exogenous hyperthyroidism, it takes time for things to settle back down.
So it seems like with exogenous hyperthyroidism, time is a key factor in recovery.
It is.
Letting your body naturally rebalance those hormone levels.
Right.
But while we wait for things to settle down, what can our listeners do to protect themselves from falling into this thyroid trap in the first place?
Well, it all comes down to awareness. And a healthy dose of skepticism. You have to be mindful of what you're putting into your body, whether it's food, supplements, or even medications.
Awareness is key. But what does that look like in our everyday lives?
Sure.
Give us some practical tips.
Well, when it comes to food, be cautious about where you get your meat, especially ground beef. Choosing reputable sources with strict quality control standards can help minimize the risk of contamination.
So maybe skip that bargain basement burger from the questionable food truck.
Yeah, probably a good idea.
Got it.
Good.
But what about those of us who love our supplements? Any advice for navigating that world safely?
Absolutely. Become a label detective. Don't assume that just because a supplement is labeled natural or herbal, it's automatically safe. Some of those weight loss supplements, for example, can contain hidden ingredients that can really mess with your thyroid.
That's a good reminder that natural doesn't always equal safe.
No, it doesn't.
And those claims of miraculous results or cures for everything under the sun should also be a red flag.
Yeah, definitely. If it sounds too good to be true, it probably is. And don't be afraid to do your research. Look up the ingredients. Check for reputable certifications. And talk to your doctor or a registered dietitian if you have any questions or concerns.
So, common sense, a skeptical eye, and a bit of research are our best defenses in the supplement aisle.
Absolutely.
What about medications?
It's crucial to follow your doctor's instructions when taking any medication, especially thyroid hormone.
Of course.
Never adjust your dose or stop taking it without consulting your doctor first.
Always good advice.
And if you are prescribed thyroid hormone, make sure to get regular blood tests to monitor your levels and make sure you're in that sweet spot. Not too high, not too low.
It's easy to forget that even medications that are meant to help us can cause problems if not used correctly.
They can.
It's all about that balance, isn't it?
Absolutely. And if you suspect you might have exogenous hyperthyroidism, whether from food, supplements, or medication, don't hesitate to talk to your doctor. Early detection and treatment are key to preventing potential complications.
So to sum it all up, be informed, be aware, and be proactive about your health.
Absolutely.
As we've learned today, exogenous hyperthyroidism can be a real issue.
It can.
But it's often preventable with a little knowledge and some smart choices.
Couldn't agree more. Knowledge is power when it comes to our health.
Well said. We've covered a lot of ground today.
We have.
Exploring the surprising causes, sneaky symptoms, diagnostic puzzle, and treatment options for exogenous hyperthyroidism.
It's been a fascinating deep dive.
But here's one final thought to leave you with. Now that you know about this condition, what are some things you might check in your own life? Like supplements or dietary habits?
It's always a good idea to take stock of what you're putting into your body. And to make sure it's truly supporting your well-being.
Couldn't agree more. We'd love to hear your thoughts.
Yes.
And any follow-up questions you might have.
Absolutely.
So feel free to connect with us on social media.
We're always happy to hear from our listeners.
Until next time, keep diving deep and stay curious.